Hi everybody, Dr. Carey here. Today I'm talking about stretches for your foot, and many people have come to the clinic with arch pain, whether it's from plantar fasciitis or heel spurs, or sometimes it's the ball of the foot. So I'm going to talk about 3 different stretches here that you can do with a ball in conjunction with chiropractic care. So first, get a ball like this, one that's softer, smaller, and has some nodules on it. You could use a tennis ball or a squash ball, but I find a tennis ball a little bit too big and a squash ball too hard, even though it's the right size. And then what you want to do is roll the ball up and down the arch of the foot. Now this is for a condition like plantar fasciitis where you have pain in the arch of the foot. Roll it from the heel to the toe area, back and forth 8 to 10 times. Do that slowly, and you can move the ball kind of on the inside and then to the outside of the foot as you go through a pattern like that. Now, if you have more of heel pain, like heel spurs, then use it more on the heel of the foot, right where the heel attaches to the arch, and then roll it in a circular fashion on that area because it'll really help with the inflammation and the muscle spasm in that area. And last, for pain that's across the toes, or we call it the transverse arch, put this in the midfoot and then roll the ball back and forth from the first toe all the way to the 5th and back to the 1st. Do that 8 to 10 times. Now I would do these first thing in the morning and then just before bed. After you do these exercises, it may cause some tenderness. So using ice after these exercises is a good idea. I would use about 10 minutes of ice 2 or 3 times just to get the swelling down. But definitely this is going to help to dissipate the swelling as well as get rid of any spasms or adhesions in the area.